Health literacy is about making sure everyone understands complex ideas and can use that information to make themselves healthier. Two experts are with me today to talk about what this means. Catherine Anderson is a senior health literacy specialist in the Office of Diversity, Equity, and Inclusion at the University of New Mexico Hospitals. Thanks for being here.
Thank you.
And Lisa Lostetter is a nurse and lactation specialist. Thank you for being here.
Thanks for having me.
All right, Catherine, let's start with you. Let's define health literacy. When we use that term literacy, how are we using it in this context for health?
Okay, so we tend to associate literacy, just plain literacy, with reading and writing skills. And when it comes to health literacy, we're talking about a constellation of skills above and beyond reading and writing. So if you need to understand healthcare information or understand what your doctor is saying to you, you may need high-level literacy skills, but also numeracy skills, the ability to understand numbers, the ability to understand biology and science, the ability to navigate a complex health insurance system. And so the skills that are required to be a health literate person are many above and beyond just reading and writing skills.
And what do we know about the percentage of people who are health literate?
Well, the last national study that was done that measured health literacy of individuals was done in 2003, and the findings are really striking. The most amazing number is that only about 12% of U.S. adults are considered proficient when it comes to health literacy. And when you match that up with the fact that hospital systems, healthcare systems, are really complex organizations. There's a real mismatch between people who can navigate the healthcare system, 12% of us, and the rest of us who have a varying degree of difficulty figuring out how to get the information that we need to take care of our health. So about a third of U.S. adults are at basic or below basic when it comes to health literacy. So those numbers are shocking.
Lisa, what does this mean for families that you work with? What do you see?
You know, I work mainly in a neonatal intensive care unit called a NICU, and there's a lot of technology. There's babies there that are sick or preterm, and I just see a lot of families coming in for the first time and being totally overwhelmed by the technology and all of the machines and the cords, and they hear beeping and they get scared. They have no idea what it means, and so it's just really helpful for us to provide them information in ways that they can understand, so that they understand, oh, that beep just means that we need to plug in the IV machine, you know, your baby is stable. And that they can take an active part in the healthcare because they understand what we're talking about.
And Catherine, can you give us another example of when someone who might struggle with health literacy, what might that look like in a hospital or a medical setting?
Well, let me give you an example of a person who might actually have quite good literacy skills. So one of the things we don't want to do is equate health literacy with literacy. So you may have a very educated person, a person who has all kinds of adequate skills to navigate another world outside of the healthcare world, but comes into the hospital or for a clinic exam and is faced with a lot of new information, perhaps a new diagnosis, and so there's a lot that the healthcare worker is explaining in that visit. As Lisa said, there may be all kinds of technological pieces around. So there's, first of all, an overwhelming amount of information very often in the healthcare world. The information that comes is often very technical. We tend in the healthcare world to use a lot of jargon, and that can be, once you hear a word that you don't know, your mind stops listening and you're trying to figure out what that word means. And you may be there under conditions of pain or stress or terrible anxiety if you've just heard a new diagnosis. So your ability to process that healthcare information may not be the same as it would be if you were sitting at your kitchen table and watching a documentary. So you are not processing that information. At the very end of the visit, the doctor gives you your medications and tells you verbally once what the dosage is and how to take them. And by the time you get home, you may not remember that information. So you may end up taking the wrong medication or at the wrong time or the wrong dosage, and so it can really have a really important impact on your health to not be able to get the information that you need.
And Lisa, you mentioned this kind of overwhelming feeling of parents with a baby that's sick or in the NICU. Do you point them to particular resources to read up and learn about some of the health concerns and health issues, or how does that work?
Yeah, we do, but I think thinking about it in different ways is helpful. So instead of putting it on the parents to say, okay, you need to learn this, to look at it like, as nurses or as doctors, it's our job to make sure that we're communicating in ways that are clear, that you can understand, and then taking an extra step to make sure that you understood. So one technique that we use is, like Kath was talking about, plain language. So instead of saying, okay, we're going to DC your baby's NG tube, we'd say, oh, your baby's doing better now. We're going to be able to take out the feeding tube in his nose. And teach back is just a technique that we can use to check for people's understanding. So not just giving information and then saying, okay, do you have any questions, but providing information and then saying something like, I know that we've gone over a lot. I want to make sure that I was clear in how I explained it to you. Can you tell me what we're going to do now to make sure that your baby is getting enough milk?
And Kath mentioned that some people might have high levels of literacy but still struggle, but lots of New Mexicans don't even have high levels of literacy. Is there a different way that you maybe meet some other parents where they're at if they don't have as high of literacy skills or as much education?
Absolutely, and just looking at not looking at the whole group and what their needs are, but each person, each family before us, what are their needs? Are the parents fluent in English? If not, we definitely want to have an interpreter when we're speaking to them, and we want to make sure that the handouts that we give them are in the language that they're most comfortable with. But like Kath was saying as well, even people with high literacy, it's stressful to have a sick baby, and often, the moms have just given birth and often they're not feeling well either. So it really seems like no matter what people's backgrounds, they appreciate the clarity of plain language. They appreciate handouts being written with key points rather than a whole lot of information that they maybe don't need to know at that time.
And how does did you want to add something?
I was just going to say one of the main roles of our office, the Health Literacy Office at the University of New Mexico Hospital, is to work with documents that come from units like Lisa's lactation unit or anywhere around the hospital. So what we do is take a document that comes to us from the cardiology lab or from lactation, and our goal is to make that document easy to skim and scan and get the information you need quickly. So we break down the language, we pay attention to the text, usually try to reduce the amount of text that's in the document. We use a lot of white space. We are very careful to use graphics that are informational, and one of the things that we love is when the unit itself can provide us with photographs that are very specific to the machine or to the patient. So in our office we are working on more than 100 documents at any one time, and at this point in the year of 2017 we've actually completed about 172 documents with the goal of giving that to both the staff as a tool that they can use to help clarify, but also something that the patient can take home and understand when they get home. Because if you have a document that's written at a very high literacy level, you may have the information, but you can't use it if you're one of those New Mexicans with low health.
Yeah. And how does that compare to, say, like a lot of folks I think try to go online to get information? Is information online more accessible, less accessible, more confusing?
Mm-hmm. Well, there's a whole ball of wax there that we could talk about. One of the things that's true, and Lisa was pointing this out this morning, is that the concept of health literacy and the awareness of the need for clear communication is really reaching more deeply into the healthcare world. And so there is an awareness CMS and healthcare.gov, their websites are pretty accessible and easy to use. Another issue is, of course, knowing what to trust when you get on the internet, and you're not just going to Dr. Google and finding information there. So that is really important. And another thing we do, Lisa pointed out, when we create handouts and documents, we will often reference a site that we're comfortable with, that can offer another way of getting that information. So it's not uniform in the internet world in terms of is the information accessible, but we're making some strides in that way.
And what do you think would change in New Mexico if more New Mexicans were health literate?
Well, there are some really serious outcomes that are affected by low health literacy. Low health literacy means that people don't come to the hospital as often. They come later. They often utilize the emergency department. They don't use preventative care. Their health outcomes are worse in general. They're more apt to make medication errors. So there's a number of outcomes that could be improved by improving health literacy.
And what do you think, Lisa? What do you think would change in New Mexico if more families were health literate?
Like Kath was saying, I think that people would be a lot healthier because there's so many people with chronic diseases like diabetes and heart disease, and there's so much that people can do to prevent those diseases, or when they have them, to eat certain foods, avoid certain foods, have certain levels of physical activity, take medicines or insulin at the right times. And when they have that knowledge, they can follow the steps. When they don't understand the instructions, we can't expect them to, and so they're more likely to get sicker and have complications.
Those are important points. Mm-hmm. And go ahead.
I think 1 in 4 New Mexicans over the age of 45 have more than one chronic condition. And you can just imagine how that multiplies the need to be able to access and use the information that you're getting. And so that's a lot of people in New Mexico who would benefit from healthcare organizations removing barriers to understanding healthcare information.
It sounds like it starts with the providers, and it's also coming together with people to talk about taking control of their own health. We'll put resources to health literacy information and the work that you do on our website at newmexicoinfocus.org. Thanks for being here.
Thank you so much for having us.